Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. The title of this episode today is I Hate My Neck and What Can I Do About It? This is such a common complaint. I hear this many times a day. Both women and men, as we get older, as the neck ages, the neck has often been neglected over time and tends to look its age or older, whereas people take better care of their faces. So often there's a disconnect between the neck and the face. One day, someone will just see their neck in a photo, a selfie, the Zoom screen, and they are horrified, and they run in as an emergency. So what is there that we can do about this difficult problem of the aging of the neck? There are many things that I'm going to touch on in this podcast that I've already done other podcasts about, so I will mention that if you want to take deeper dives. The problems on the neck are multifactorial. I'm going to discuss neck bands and how to treat them with Botox, then horizontal neck creases and how to treat them with fillers. Then we will address sun damage, which can include hyperpigmentation and redness and broken capillaries on the neck. Then we will tackle briefly the extra fat and double chin. And then last but not least, we will discuss loose skin on the neck. Let's start with the fact that I am a board-certified dermatologist and I do not perform plastic surgery. And many of the issues of the neck can be fixed with plastic surgery, i.e. a neck lift. But typically when I'm doing my consultations, it's patients that do not want surgery and are looking for non-invasive approaches to improve their necks. However, if somebody needs surgery and the non-invasive methods will just not work for them, I will tell them so. And a general rule of advice is before you get involved with expensive, complicated cosmetic treatments, it's always good to get more than one opinion and do your research well. So let's start with neck bands and Botox. This is actually very easy and very successful. So when you smile, if your neck bands fan out into these taut, tough bands that go up and down vertically on the neck, and typically there's more than one, then these are very easy to treat with Botox. Botox is not FDA approved for this, but I have been using it for many years with great success. It just relaxes those muscles. The main side effect, which I always mention to people, in addition to bruising, which can happen from any type of injection, is that if you lie flat on your back and try to do sit-ups or crunches, sometimes it's hard to get the head to lift up because the anterior, the front of your neck muscles are weaker from the Botox. I will say that I noticed this myself, but I've never actually had a patient complain about it, but I do think it's true. Also, I will often try to treat the crepey skin that's a little crinkly, that worsens with movement, with low-dose Botox, which is different than the vertical neck bands. And the vertical neck bands respond really well, but the crepey skin does not respond as well, although sometimes it does help a bit. So a little bit of low-dose Botox can often be worth it to make the neck look younger by reducing the vertical neck bands and helping a little bit with the crepey skin that is sometimes due to underlying muscle motion. There's a whole podcast or two on Botox, so if you want more information on Botox, please listen to those. Botox is done in an easy office visit, and it lasts about 3 months. Moving on to horizontal neck bands, I find that fillers can help this significantly, but fillers are not really made for the neck. They're made for the face, and the neck skin is just very different. So it's not just any filler that you can use on the neck. The one that I have found that works the best here is Belotero, which is a very thin hyaluronic acid filler. I find that other fillers can be increased risk of lumps and bumps. And while that can happen with Belotero, it is less common. This is also an off-label area for fillers, but it works incredibly well, and it definitely can last 6 to 12 months. The main side effects are bruising and bumpiness. I have many young women in particular who do this treatment because they somehow have genetic bad horizontal necklines, and it's out of proportion to their age. And so I find that fillers really can fix this, and the satisfaction rate from this procedure is pretty high. But it's not that commonly done, but if you do have those horizontal necklines, fillers can really help. Now I'd like to talk about redness and brown spots from old sun damage, which is extremely common on the sides of the neck. These can be addressed pretty easily with lasers. Pulsed dye laser or intense pulse light will reduce the redness. There's an entire episode on treating rosacea, which is also redness with pulsed dye laser and intense pulse light. So if you want more specific information, you can listen to that. And for the brown spots, I typically will address them with either Fraxel or clear and brilliant laser. Also sometimes chemical peels. And there's definitely a whole episode on Fraxel and clear and brilliant, and there will be an upcoming episode on chemical peels. Any of these, whether it's the lasers or the peels, are repeated treatments, and they all have some sort of downtime associated with them, but they work really well for reversing that old sun damage. I often recommend to do these in the winter when people can wear either scarves or turtlenecks while they are waiting for it to heal after their treatments. The tricky thing for this is that some of the red spots and the broken capillaries and the brown spots will come back, or new spots will come out over time, since these issues are really from sun damage from years ago, and patients do need ongoing treatment to keep it in check. So once we get the neck better in terms of reducing the red and the brown, I will usually recommend 1 or 2 treatments every winter to keep it in good shape. Regarding fatty deposits on the neck, such as a double chin, there's an entire episode on that. And for a quick summary, we can basically do cool sculpting, which is fat freezing to remove that fat, and it also sometimes tightens the skin. Or we can do Kybella, which is an injection that dissolves fat. Or we can do liposuction, which is a surgical procedure. I don't perform that, but I can refer somebody out for that if that's what they prefer. Liposuction does have small scars associated with it, but it is the most aggressive treatment for extra fat on the neck. Moving on to the most difficult subject, which is loose skin. Loose skin on the neck is the toughest to fix. And this is where a surgical neck lift is going to be the best results by far. But there's a lot of patients who don't want the risks of scars and surgery, or the downtime from that, or the expense. And also sometimes they just have a small problem, then they're really not eligible for surgery because it's not that bad. And in my office, I offer people a consultation for 2 different devices that can help tighten skin. One is Ultherapy, or Ulthera, which is a deep ultrasound. Again, there is a whole podcast just on that if you want to listen to it. But in summary, there's no downtime from Ulthera, but it does hurt when the treatment is being done. The concept is that it burns tiny holes underneath the surface of the skin, and then the collagen remodels over about 6 to 9 months and helps pull the skin tighter. I find that it works best for thin-skinned people with small amounts of loose skin. If the skin is very loose, then surgery is going to be much better, and honestly, I will decline to do Ultherapy for those patients because I like great results, and if there's a lot of loose skin, Ulthera is not for you. We also have Elicor, which is a relatively new treatment. It's a skin removal device that removes tiny pieces of skin. It is not FDA approved for the neck, but I have done some necks and gotten nice results from that. So that is also something that I will discuss with patients, and there is also a whole podcast just on Elicor. Also for pulling the loose skin, there are threads, which can temporarily pull the skin up. I personally do not use these, and they do not last very long, but threads are possible. Some people might recommend microneedling to help rejuvenate the neck. I'm not a big fan of microneedling. I've just seen too many complications from it. I prefer to stick with my lasers, lights, peels, injections, and devices to rejuvenate the neck. But threads are possible. Microneedling is possible. I just don't do those for various reasons. Threads, I just don't think they last long enough. And microneedling, I just don't like the side effect profile. And then last but not least, I'd like to just mention skincare and sun avoidance. There is nothing like daily sunscreen and reapplication of sunscreen to help with anti-aging of the skin on the neck. I would say almost uniformly, people forget their neck with sunscreen. They'll treat their face really well, but they won't put anything on their neck. They don't want to get it on their skin. They don't think about it. But sunscreen really does go a long way to help protect the skin of the neck. I like to remind people that UVA rays come right through your car windshield and will age your skin, as I will say, in dog years. So it's best to put on sunscreen every day and reapply it, even if you're just in your car or out and about running errands. Sunscreen is really helpful. So I usually recommend an SPF 30 or above. Find one that works for you. I personally like zinc-based sunblocks. Again, there's a whole episode on sunscreen if you'd like to listen to that. In addition, there are creams that can help with the anti-aging of the neck. Moisturizer is important. Obviously, don't let that skin get dry. But if you can tolerate a retinoid of some type a couple of nights a week, such as retinol or prescription strength retin A, otherwise known as tretinoin, these can help stimulate collagen, reduce brown spots and wrinkles. So retinoids are good if you can tolerate them, but they can be irritating. Glycolic acid is another alternative, not as irritating if you can't tolerate the retinoids. And I do like either a vitamin C serum in the morning underneath sunblock or a peptide cream. But basically, all four of those chemicals can be used and rotated. Retinoids, glycolic acid, vitamin C, peptides. It depends on your skin and what you can tolerate and your schedule. But creams can really help with the anti-aging program of treating the neck. Probably the thing that people complain about the most on the neck is the crepey skin. And we've talked about lots of ways to improve the neck, but nothing is a slam dunk for the crepey skin. It's usually a combination of a little bit of Botox, some laser resurfacing, good creams, sunscreen that help make this better. It's really almost impossible to make it perfect. But I think if we take the neck and we do a wholesome approach and treat everything, the loose skin, the sun damage, the red spots, the brown spots, the muscle motion, and we hit it with all that we've got, oftentimes the crepey skin does improve to some degree, but that is probably the toughest nut to crack in terms of rejuvenating the neck. So in summary, as you have heard, rejuvenating the neck has many options. There are no two necks that are identical, really. Even twins are sometimes a bit different. So you need to discuss this with your doctor, and this is very complicated, and I would advise a discussion and a consultation with a board-certified cosmetically oriented dermatologist, if possible, if you're looking for non-invasive ways to improve your neck. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.